I'm going to be speaking on restless leg syndrome. This is a common condition but highly underdiagnosed and undertreated. So, it's very important for us to identify this because we can improve the quality of life of the person. So, what is this? Restless leg syndrome, otherwise is known as an RLS. This was first described in the 17th century itself by Sir Thomas Willis. It is otherwise known as the egg bomb syndrome, and this was egg bomb in 1940 who recognized this condition, which leads to a significant impact on the sleep quality as well as daytime functioning of the patient. So, that is how it came into prominence. Poor recognition and frequent misdiagnosis was shown to occur in a survey which was done in Europe and USA, showed only correct diagnosis in only 7%. Based on the criteria for the diagnosis of RLS. This is coming under sleep disorders, coming under movement disorders in neurology. So, neurological disorder, it's a movement disorder since people are forced to move their legs in order to relieve the symptoms. It's also classified as a sleep disorder since the symptoms are triggered by resting and attempting to sleep. It is best characterized as a neurological sensory disorder with symptoms that are produced from within the brain itself. It's a movement disorder, certain part of the brain is affected. Sleep disorder, certain other part of the brain is affected. But it's a sensory disorder, symptoms that are produced from within the brain itself. And you will be surprised to see that it is present in 8% of the general, 8.5% of the general population. But many of us do not make a diagnosis because we do not ask questions about this, and patients also do not think this is a symptom to tell us. Especially when they say they are finding it very difficult to fall asleep, and they keep telling that I am tossing and turning in bed. You also have to ask about their movement, there are any funny sensations in their feet, and whether they find it better when they get up and walk. So, RLS is diagnosed frequently of 7.2% in the REST study. So, one which is mentioned here, Restless Leg Syndrome Prevention and Impact Study, REST study. The frequency is 7.2% in this study, which involved 15,391 adults in US, and 3% of the patients had symptoms at least twice weekly, and this was moderate to severely distressing. So, this study highlights the need for better understanding of this condition, taking into account the high prevalence and the significant functional impact and low rate of diagnosis. So, there is three issues which have to be considered. We have to know about the condition. There is a high prevalence. So, many people are disabled, have a functional impact because of this, and low rate of diagnosis means low rate of relief of these symptoms. In 9 to 10 patients with RLS suffers, they reported at least one sleep related symptom. 7 of the 10 of these patients reported taking over 30 minutes to go to sleep, and about 6 of the 10 reported they woke up at least 3 or more times during the night. So, sleep is disturbed, and sleep disturbance also can produce harmful effects on the body. This study on the diagnostic indicators of restless leg syndrome in primary care, this study was done, this is a reference I have quoted here, reported the spontaneous complaints of sleep or leg symptoms are frequently associated with the diagnosis of RLS. They complain of sleep symptoms or some leg symptoms. Think about RLS also when you are managing the patient. So, who is affected by this? As many as 1 in 10 people are affected by restless leg syndrome at some point in their lives. Some it may go away, some it may stay. And women are much more likely, twice as likely as men to develop restless leg syndrome. It's more common in the middle age. Those symptoms can be in any age. Even some children can have restless leg syndrome. What causes this? It's often found in families, especially when the onset is before 40 years of age, and it has also been associated with some gene variants. But a lot of evidence there to indicate that low levels of iron in the brain may be responsible for the restless leg syndrome. It's much more common in individuals with Parkinson's disease, which is a disease of the basal ganglia where the dopamine pathways are affected. And in RLS, this restless leg syndrome, also the dopamine pathways gets affected. So, let us see how this occurs. Pathophysiology of the restless leg syndrome. There is an important role for basal ganglia to play. It's a dopaminergic diencephalic spinal pathway syndrome, and part of it is the basal ganglia. what happens here is the basal ganglia is very much important for the smooth, purposeful muscle activity and movement. Suppose I want to take a pen and write, like I am going to take a pen and write, then I should know how to take the pen and how to write it. For that, the basal ganglia is very much needed. And basal ganglia main neurotransmitter is dopamine. They found that this dopaminergic deficiency can produce the restless leg syndrome in 1982, and the symptoms can be improved after substituting the levodopa. So, this is the pathway. You can see it can affect in different ways. From the diencephalon, it comes down, it also affects the spinal cord because it has to initiate movement and also affects the sensation and can affect many things, even the leg muscles. So, there are different pathways, but this is one of the main things.